Exercise and staying active are an important part of achieving success with your BodyMedia Fit system. However, for people like myself who have chronic back and neck pain, staying active can be a real challenge. As I've mentioned, I was a competitive and professional figure skater for over 25 years. Great sport, but caused a lot of heavy toll on my body over the years. At some point I realized that the pain I was experiencing was going to cause me to change the things that I did. I'd have to give up fun things I enjoyed doing, like skating with my kids. That's when I decided to start seeing a chiropractor, and my concerns about staying active fell by the wayside. I started to feel better and lead a really healthy, active life. When I relocated to Pittsburgh, finding a good chiropractor was almost akin to finding a good hairdresser, and I feel like I found a great one here in Pittsburgh. I'd love to share with you some of the insights and learnings I've had over the years from my chiropractic care. So today, I'm here with Dr. Patrick Jones, my chiropractor, who has over 10 years of experience in the field. He's agreed to share some of his tips and knowledge with our BodyMedia Fit users.
I see a lot of people in Chris's position. At a very young age, they're very active, sports-related injuries that they typically sustain. And then as they get older and transition to the workforce, they tend to sustain more of the postural-related injuries, the ones that just kind of nag and bother them due to traveling on planes, buses, sitting at a desk all day long. It's these activities that chiropractic can really help with. I really find it unfortunate when a lot of people start to give up on the things that they love because their knee hurts too much or their shoulder hurts too much, or they just feel like they can't do it anymore. And they start to have to change medications, things like that they have to take for these. That's really unfortunate, because if those people were to get and see chiropractors, they would really see a substantial change in their ability to perform those activities. And it's that pleasure that brings me to get people back to what they used to love and really helping restore their health and maintain a healthy lifestyle.
So let's start from the beginning. When should someone see a chiropractor, and what might be some symptoms or signs beyond an injury that would trigger someone to see a chiropractor?
It is a very difficult question because there's a huge realm of injuries and things like that, and people have different tolerances. I do believe that at a point in your life when you can't manage your pain and symptoms yourself any longer, when you need some kind of an outlet, I think that's a great time to see a chiropractor. I also believe my rule of thumb with patients is that generally if something's going on for 3 or 4 weeks and it's not getting better, that's a prime example of when you should be going to see a chiropractor.
So what should people expect at their initial visit?
So generally, you can think of it as a consultation. We're going to sit down and talk about your problem, get a little bit of history, some things that will actually allow me to get a little more insight into why you have the problem and why is it persisting. And secondly, I try to give a treatment on the day of. Unless there's a reason why we need to send you out for testing or blood work or something like that, or go see your family doctor, initially I try to get a treatment on the first day so you can actually start to begin to feel better, and we can get this cleared up as quick as possible.
So tell me about finding a chiropractor. I know when I first started looking, finding the right chiropractor was a bit scary. Any suggestions on what someone should consider or questions to ask when looking for a chiropractor?
So you have to find someone that you're comfortable with, and find someone that's actually wanting to treat your pain, your health, your well-being. All those things chiropractic can help with. You basically need to find the guy that can help you the best.
All right, so tell me about some of the ways that you work with your patients with chronic injuries.
So with some people, it's as simple as a few adjustments, a little bit of soft tissue work, and they're better. With other people, you really have to dig in a little bit deeper and truly get the best outcome. A lot of people need nutritional counseling. People don't realize how much their diet can affect their overall feeling of pain or not pain. Not everyone can get 100% better, but almost everyone can get better.
So what are some of the common ailments that you see that can be addressed to help people keep moving and stay healthy?
Yeah. Well, of course, in a chiropractic office, you see the necks and the backs primarily. It's what we've been known to do. But in practice, I've really tried to expand my horizons a lot. I do great work with shoulders, elbows, hips, knees. It's really important to get into all of them. There's not usually one thing that's easier to fix than another, and everyone responds differently to care.
So what are some things that you can suggest to help people stay more mobile and be able to lead a healthier, active life?
What I find most important for people is they tend to just become rounded. Everything they do goes forward now. Shoulders go forward, head goes forward, low back goes forward. One of the most simple things you can be aware of to keep these nagging injuries from recurring is keeping things backwards. They can alleviate the strain on their back or their neck or their shoulders by keeping them back. It can make a huge impact on the way they feel day in, day out.
Dr. Jones, thank you for sharing your expertise and your thoughts today. You know I'm a big believer in chiropractic, and it's really helped me stay healthy and active.